Welcome to the third and final session in the Aged Care Virtual Education Series. Today's topic is healthy ageing. So to start the meeting, I'd like to take a moment to acknowledge that we're meeting on the lands of many Aboriginal nations across Western and Far West New South Wales. On a personal note, I'm on Wiradjuri country today in Dubbo, but I was born and raised in Wilcannia on Barkindji land. I'd like to pay respect to elders past, present and future and acknowledge their continuing connection to land, water and community and their role as caretakers of ancient stories and culture. I warmly welcome all Aboriginal and Torres Strait Islander Australians today and everyone present. So just a couple of quick housekeeping points before we begin. Please make sure you're on mute. Please pop your name into the chat box so that we can get a certificate to you, especially if you're sharing a device to watch today's session. There'll be a Q&A session at the end of Toby's presentation, but if you've got anything, a burning question, just pop it into chat and Toby will get back to you at the end of the session. A QR code will be displayed on the last slide. If you could give us your feedback, that would be greatly appreciated. And just a quick reminder that today's session is being recorded. So now it gives me great pleasure to introduce Toby Booby. Toby is a clinical nurse specialist with the Transitional Aged Care Program. So I'll hand over to you now, Toby. Thank you very, very much for being with us today.
No worries. Hi, everyone. I'm going to be presenting on promoting healthy aging, which is a very broad topic. The information in this will be a bit broad, but we can add any questions we get at the end. So I guess to understand first what promoting healthy aging is, we need to talk about healthy aging. The World Health Organization defines healthy aging as the process of developing and maintaining the functional ability that enables well-being in older age. This definition highlights that healthy aging is not just about avoiding disease or disability. It's about creating environments and support systems that help older people function and maintain their functional ability. Functional ability in itself means having the capabilities to be and do the things that are meaningful to an individual. It's about enabling people to meet their basic needs, which includes access to food, shelter and healthcare. It's about enabling people to learn, grow and make decisions, which ties into lifelong learning and maintaining autonomy and agency as people age. It's also about being mobile and ensuring that people can move safely and easily within their environments. And also building and maintaining relationships such as social connections, which are critical to mental and emotional well-being. And finally, it also includes contribution to society, which is recognising the value and participation of older people in communities through work such as volunteering or other meaningful activities. So healthy aging is broad, it's holistic, and it's a concept that goes beyond simple managing health conditions. It's about promoting environments and policies that allow people to continue living lives they have reason to value right throughout their later years. So Australia's ageing population is growing rapidly. Projections at the moment indicate that by 2050, over 22% of Australians will be aged 65 and over. This demographic shift presents a lot of challenges and opportunities for public health, aged care and social policies. One of the primary approaches to promoting healthy ageing is a strong focus on preventative healthcare. The Australian government has several initiatives such as the National Preventative Health Strategy, which supports early screening, vaccination programs and lifestyle interventions to reduce the burden of chronic diseases. By fostering a culture of proactive healthcare, older Australians can maintain independence and well-being. Social engagement also plays a crucial role in the ageing process, with community participation programs, volunteer networks and digital inclusion efforts to help seniors stay connected and mentally active. This approach not only enhances quality of life, but it also reduces the risk of loneliness and of cognitive decline. So I've just also got a little graph here which just shows the projection of the Australian population aged 65 and over time, which as you can see it is climbing quite rapidly. Australia's ageing population, basically Australia's population is ageing rapidly, driven by declining birth rates and increasing life expectancy. As of 2024, the average life expectancy stands at 81.2 years for men and 85.3 years for women, which makes Australia one of the longest living nations globally. By 2050, over 8.8 million people will be, which is 22% of the population, will be 65 and above. as we can expect, this shift will place substantial pressure on healthcare, aged care services and economic structures. Governments and policymakers are actively developing strategies to support this growing demographic. The ageing workforce presents unique challenges as well, which includes labour shortages, increased reliance on pensions, which basically means encouraging older Australians to remain in the workforce longer through flexible employment opportunities, and skill development programs is becoming an essential policy to focus on. Physical health and ageing. So maintaining physical health is one of the most effective ways to ensure a high quality of life in older age. Regular exercise plays a key role in preventing chronic diseases such as heart disease, osteoporosis and diabetes, which are prevalent among the elderly. The Australian Physical Activity Guidelines recommend that older adults engage in at least 150 minutes of moderate intensity exercise per week, which includes things like walking, swimming or yoga. Strength and balance exercises are also crucial to prevent falls, which is a leading cause of injury in older Australians. By incorporating regular movements into daily life, older Australians can significantly enhance mobility, maintain independence, and reduce their risk of developing age-related conditions. There are several community-based programs available, which includes exercise groups like the Heart Foundation walking groups. And they further encourage participation and social engagement, reinforcing the connection between physical and mental well-being. Mental health and cognitive well-being. So mental health and cognitive well-being are crucial aspects of healthy ageing, with over 400,000 Australians currently living with dementia, which is expected to double by 2058. Preventative strategies are vital. One of the most effective ways to support cognitive health is through social engagement. So studies have shown that maintaining a strong social network can lower the risk of depression and cognitive decline, making community participation essential for older Australians. Cognitive stimulation is another key factor. Activities like reading, solving puzzles, learning new skills and engaging in creative hobbies have been shown to slow cognitive decline. Many programs across Australia, including the Dementia Australia's Brain Track app, focus on brain training and lifelong learning to help older individuals stay mentally sharp. So nutrition for healthy ageing. Good nutrition is key to healthy ageing, supporting physical and cognitive health. Older Australians require a balanced diet rich in protein, fibre, calcium and vitamin D to maintain muscle mass and bone strength. However, ageing can bring challenges such as reduced appetite, difficulties in cooking, medication side effects and financial constraints. And addressing these barriers through tailored dietary recommendations and support systems is crucial. Government and community initiatives like Meals on Wheels and senior-specific dietary programs help ensure that older adults have access to nutritious meals. Encouraging hydration, meal planning and social dining opportunities can further enhance their nutritional well-being. Preventative healthcare. So preventative healthcare is essential for promoting longevity and quality of life in older Australians. Regular health screenings help detect chronic diseases early, improving treatment outcomes, reducing long-term health costs. Vaccination programs are also crucial in preventing serious illnesses. Older adults are particularly vulnerable to infections like influenza, shingles and pneumonia. And so the National Immunisation Program schedule provides access to free or subsidised vaccines to protect public health. Advancements in geriatric medicine, including wearable health technology such as personal alarms and telehealth services, are transforming how seniors receive medical care. These innovations allow for continuous health monitoring and remote consultations, making healthcare more accessible and effective. Chronic disease management plans are also available and provide a multidisciplinary approach to managing chronic diseases. Social engagement and community participation. So social engagement is a key factor in maintaining mental and emotional well-being as Australians age. However, 1 in 3 Australians experience loneliness, which has been linked to an increased risk of depression and cognitive decline. Community and volunteer programs play a significant role in fostering a sense of belonging. Local initiatives like men's sheds and CHSP-based social groups provide opportunities for seniors to engage in social, cultural and intergenerational activities, helping them remain active and connected. Digital inclusion is another critical area of focus. Teaching digital literacy allows older Australians to stay in touch with family, access online services and to participate in virtual communities. Government and non-profit programs such as Be Connected are expanding digital education efforts to bridge the technological gap for seniors. Technology and ageing. So technology is transforming the ageing experience, offering new ways to enhance healthcare, connectivity and independence. Telehealth services have become increasingly popular, allowing seniors to consult doctors remotely and access digital health records without leaving their homes. Wearable health technology such as smartwatches and fall detection devices is helping older Australians monitor their well-being. These innovations provide real-time health data, alert caregivers in emergencies, and support proactive healthcare management. To bridge the digital divide, the government and non-profit organisations are offering digital literacy programs like Be Connected to help seniors use smartphones to do online banking and access social media. These efforts ensure older Australians stay connected, informed and engaged in an increasingly digital world. So government policies and support systems. The Australian government plays a crucial role in supporting the ageing population through well-structured policies and programs. Aged care services are at the core of these initiatives, offering home care packages, residential aged care and respite services to ensure older Australians receive the necessary support. Financial security is another key focus, with pension schemes like the aged care pension and superannuation policies designed to help provide a stable retirement income. These measures help seniors maintain financial independence and afford necessary healthcare and living expenses. Beyond financial and healthcare support, active ageing policies encourage lifelong learning, physical activity and workplace participation. There are many programs aimed at keeping older Australians engaged in the workforce and community to foster a more inclusive and productive society. So I've got a list of helpful resources here. I've actually got another list that I'll provide at the end, which just has some local resources which could be of use for these things. And I've just got another little video I'd like to play. I'll just see if this is going to share sound.
My name is Heather Lee and I'm 96 years of age. I tell everybody I'm 96. I don't mind telling people that. The thing about aging, well, it's an achievement for a start, and I think it's something to be proud of, you know, which I am. I'm proud of it. I've lived a good life and I'm 96 years of age, no complaints. When my husband died, he said, now is the time to show your mettle. And those words, they still make my hair stand on end when I think about it. I think he knew that I was not very self-assertive and I was going to be on my own. In other words, you've got to stand on your own 2 feet now, girl. You know, it's time to sort of shape up. I had this compulsion to walk, and I didn't walk.
Sorry, is that phrasing?
Yes, Toby.
To smell the roses. I was walking, and the faster I walked, the better I felt. So it was grief therapy, really. In 2011, I was 84. I was talking to my physiotherapist, and he said, why don't you go to the Masters Games? They're being held in Adelaide this October. After I'd finished a 10-kilometre event, there was a local magazine here, and they rang me up and he said, how did you go at the games? And I said, oh, I think I got 4 gold medals. He said, well, what were your times? And then I told him, and he said, well, you've broken world records. So I thought, well, that's what I want to do. I really wanted to be the last man standing, and I also want to be the best I possibly can as an athlete for the rest of my life. And shed many tears, become philosophical in many ways, and learn to grow older with stayers who stayed. When I became New South Wales Senior of the Year, I had to write a message to speak to people. And I said to my trainer friend, well, I don't know what I'm going to say. I really didn't know what I was going to say. And funnily and suddenly she said to me, well, you are the message. And I said, that's it. I got up and I stood there and I said, I am the message. We're all getting older. No one's going to escape that fact. I think the secret is to keep going, keep your mind active, find things you can do, diet and exercise. Even you can do in little sort of exercises at home and things like that to keep moving, because I think if you can get your heart rate up just a fraction, it's going to help you and keep up with younger people and older people at the same time. And we can pass on the sort of recipes and different things of years ago and just pass on our knowledge to younger people all the time. I don't really want to inspire people. I want people to aspire themselves. to do the best they can as they grow older. But that's it. But, because I find that that's what they should really be doing. I like to get up and get going and prove that I still can do it.
So I think she provides a very good example, probably of the higher end of the spectrum of what healthy aging actually is, but still very much outlines the benefit of physical activity as one ages. So some key takeaways from today, I guess, promoting healthy aging in Australia requires a multifaceted approach that includes proactive individual strategies, strong support from the government and community involvement. Older Australians who prioritise physical activity, balanced nutrition and cognitive engagement can maintain their independence and well-being well into later life. The Australian Government continues to expand aged care services, financial support programs and healthcare accessibility to enhance the ageing experience. These initiatives help seniors navigate ageing with dignity and security. Additionally, the role of social connection and technology in ageing cannot be overlooked. By staying engaged with their communities and embracing digital tools, older Australians can lead fulfilling lives and remain active members of society.